TMJ, or TMD as some people know it, is basically the joint where your jaw hinges upon in your skull. So when people have a clicking and a popping, it's a not proper functioning joint. Some people adapt to that situation and have no discomfort with it at all. They still have an improperly functioning joint, but they have no problems, no headaches, no soreness, no limitations of what they eat. Other people will have clicking, popping, grinding, or even no noise, but they have constant headaches, constant neck aches, constant sore muscles in the cheek area or in the back of the head. Those are all signs and symptoms of TMJ. And where a dentist comes in and where our role is usually the bite is off in some way, whether it's too overclosed, whether it's too far back, it all depends, but usually something is going on, that the teeth are in the wrong position and the teeth and the muscles are fighting each other, and it's causing the damage in that joint. And because the joint is so small and so compressed, it can impinge on many of the nerves and blood vessels that are running in there and cause what people think are migraine headaches might be coming from the TMJ. What people might be thinking are earaches might be coming from the TMJ, because it's all this little network of muscles within the same confined area. So as dentists, we take a look at the joint, we see if you're having problems, and we can also help treat. So a lot of times migraine sufferers are really actually TMJ patients, just need some kind of mouth appliance or a mouth reconstruction to restore their bite to the proper spot and to avoid the pressure on the joint. We have equipment in the office that helps us diagnose the proper position of the jaw and the proper position of the muscles. So it's a computerized scan, it's a 3D motion. And what we do is really relax the muscles, and then we track it through different jaw positions with the opening and the closing and the side to side. And through all these trajectories and through all these measurements, I can figure out where the jaw needs to be. And then we can make it's called an orthotic. It's similar to a mouth guard. It's a little piece that the patient wears on their lower jaw. And we reposition the jaw to the proper spot. And most times within a couple days, the patient feels much, much better. Their headaches are better. And then we fine tune the position, get them comfortable, and then we figure out how we're going to restore it there, whether we do braces to keep them in that position, whether we do crowns to keep them there, or a combination of both. But that's neuromuscular dentistry. It's going through the equipment to figure out where the proper position is so that the muscles, the joint, and the teeth are all in the harmony and all working together to not impinge on any nerves or muscles. And it really has been very, very successful in treating people's TMJs and helping with their headaches.